بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. Everyone have a problem in his life and he's praying to be zero problem in his life. But I think we should pray also to have a power to solve our problems. And one of these powers are the communication skills. I am talking today about the skills of communication between person to person. It's not a communication through the telephone or through the internet or emails or memos. It's the direct communication, how you communicate between each other. Our presentation will contain importance of good communication, communications component, body language, listening to the patient, and I will take two scenarios. One of them is the breaking the bad news to the patient, how you break the bad news. And the last thing are how to be a good speaker. Simply two slides, how to be a speaker to the audience. Communication is a process by which the information are exchanged between two persons. Sound is what? Okay. Communication, I think there is echo. Can you hear me at the back, or my sound is not good? I can speak better without mic. So communication is a process by which information exchange between two individuals through different symbols, signs, and behaviors. Sir William Osler saying that the good clinician treats the disease, but the great clinician treats the patient. The effective communication at hospitals and health systems contribute to the development and sustainability of a culture of safety. So when we have good communication, we have a good safety. Communication failure were linked to 1,744 deaths during 5 years and $1.7 billion in malpractice costs in USA. 1,744 deaths because of the communication failure. And more than a quarter of the hospital readmission could be avoided by good communication between the patient and the healthcare provider, and then between the both healthcare providers. And when they analyzed the legal records of 23,658 cases in the United States, they found that 7,000 cases of these legal cases is because of the poor communication. The doctor didn't tell me, the nurse didn't instruct me well about the medications. The doctor thinking I am lying, he did not appreciate my pain, he didn't give me time. So nearly 30% of the complaints because of the communication rather than the medical errors. Okay, so the study is showing that good communication, improving the patient satisfaction, better disclosure of important information, greater adherence of the treatment. Patient complain with the medication, he will trust you, he will use the medication you are giving to him. Reduce emotional distress between the two healthcare providers and also with the patient and the physician, patient and the nurse. And also improve the patient outcome. This is a document by the HIV patient in 1985. He's writing very sad message that when the result arrived 8 weeks after, the doctor told me straight away, a doctor I had never saw before, told me straight away, you have got AIDS. At that time there was no difference between HIV and AIDS. And they left the room to leave me to cope with this news. Of course, I was feeling almost dead. I was giving myself 3 months to live, and 3 months after, instead, there I was, self-destructive, using more drugs and using more drinks. What you are saying is that, as a result of the test, being handled really badly by the doctors. you ended up getting even more self-destructive in the immediate period afterwards. Yes, nobody was asking me how I was feeling. It was only come to the hospital once a month to have a blood test, and we will tell you the answer next month when you are coming in. But I don't know what the answer was. I don't know what they were looking for. So imagine ourselves that we are the patient and we are badly communicated with the doctors. How you feel? Did you trust the doctor? Did you trust the institution? You will not trust everything, and you will feel from inside you are badly handled. What's the chronic problem of the communication? Why there is a problem in everywhere, the problem of communication? It's because first, educational differences. One coming from this culture and one coming from this university, giving high attention to the communication skills, and the other university, for example, no attention to the communication skills. Skill level, highly skilled or low skilled. Stress, we are working in a stress. And fear, you are afraid of communication. I don't want to talk to this patient. He will thinking that I am treating him and so on. The nurse make a problem, the other nurse come in, I will not talk to him. This, when you increase the gap of fear of communication, your skills of communication will be dropped and the problem will be created in the hospital. Language, for example, English speaker with Arabic speaker. The English speaker, he don't know Arabic, they are only using symbols, of course there will be communication failure. Personality, some persons are antisocial, they don't want to communicate, others, they like to communicate. And the past experience, both personal and professional, these affect individual behavior. On the other hand, in the institution, lack of time, cross-cultural diversity, overload of the information, too much information, you cannot pass it all. All these, with the chaotic hospital environment, lead to organizational behavior. This is affecting the organizational behavior. So this organization, if all these factors are present, of course the communication will be not good. What is the component of communication? The communication between person to person contains three elements: the verbal, paraverbal, and the non-verbal. The verbal, the text I am telling the patient, for example, the information about his disease, prognosis, investigation, what's going to be done next, the investigation, any text I am telling the patient, this is called verbal. This verbal should not include jargons or medical terms. For example, if I tell the patient you have acute illness, he's thinking I'm talking about severity, but I am talking about the sudden onset of the illness. If I told you your nerves, he's thinking I'm talking about anxiety, but I'm talking about the neurological system. If I talk about diet, he's thinking about restriction of the calories, rather than I'm talking about his food and his intake, his oral intake. So try to avoid the medical terms in front of the patient. If I said your stomach, he's thinking all the abdomen. He's not thinking his organs. So try to avoid or verify. If you say the medical term, you tell him, I mean this one. Because as far as you are using medical terms, the gap will be increased with the patient. Okay. The second thing is the paraverbal. The paraverbal is the text you are telling, but in which sound? What is your sound? The tone is the musical part of your sound. How you are saying this text to the patient. The second thing is the pitch. Is it high or low? Pacing, are you speaking very fast? Are you giving space, rest? If you are talking very fast to the patient, really he will not trust you. He will stop and then asking, is this medication you mean this dose? Are you sure, doctor? Is this medication used for it? Because he will not trust you and thinking that you are telling something very fast, and this will make a mistake. The volume of the voice, now I'm talking loudly because I want the audience at the back to hear me, so the volume depending on the person you are talking to. try not to use the monotonic. For example, monotonic, I'm Dr. Manaf Shakir, I'm consultant pediatrician, I'm talking today about communication skills. This is monotonic. It's nobody like the monotonic sound because it's boring. Everyone, when you talk in a monotonic, he will be sleepy immediately. So try to make your sounds polytonic, decrease the sounds, and make it more accepted by the person you are talking to. The last thing is the non-verbal, the posture. You are talking to a person, how is your posture appearing? He will analyze. With experience, we will analyze. This person looking at me, he don't like me. From the experience, and you will see the next slides. So the gesture is the symbols we are making in our face and hands to show something. For example, this technician showing a gesture to help the pilot landing in a suitable place. This is called gestures. Okay, when you say like that, this is gesture. A symbol everybody knows. The eye contact. Eye contact is very important. Now I am distributing my eye contact to everywhere. So all the audience thinking that I'm looking to her, to him, to. So eye contact should be distributed. And when you talk to someone, try to make eye contact, because without eye contact, it may show not respect. You are not respecting him. You are not paying attention to him. So you should make an eye contact. Facial expression is very important. Are you smiling? Are you looks mask face? No expression. You should make your facial expression good to the person you are talking to. The special distance, for how long, I'm talking to someone there, your child have a blah, blah, blah. This is not good. You should have a good distance between you and the person you are talking to. How you are wearing, how are your clothes, this is good general appearance. As far as you are talking to someone, your general appearance is a communication. Okay. It's important that the consistency of the verbal, non-verbal, and paraverbal. I mean, if this guy told you, I like you, I respect you, with this sharp eyes and clenched jaw, did you believe him? No. If the President Obama coming after the meeting and say all the problems are solved with this facial expression, did you believe him? No. You will believe the non-verbal, not the verbal. You will believe whatever he says, you are not believing him. And if this man telling you, leave your son in the hospital and go, we will take care of him. Don't worry, we will do our best. You will not believe the words. You will believe the shape, the gesture of this man. Am I right? You will not believe him. So if there is inconsistency between verbal, non-verbal, and the paraverbal, what will happen? The patient or the listener will be confused. What will be at the end? There will be lack of trust. He will not trust you. Whatever you are telling, I am doing that, I am doing that, but your facial expression and your gesture showing him the opposite. So you will lose the trust of the person you are talking to. Now let's practice. Everyone told me the first one is simple. She looks happy. Am I right? And what is this facial expression? Surprise. Good. And this one, if this is very.
It's not believe. It's not believe what they are saying.
Sorry?
Not believe what he's saying.
Not believe. Okay. What? Disappointing. Other one? If somebody looks at you this way, he is content. It means he don't like you. He don't believe of you. He don't like the way you are talking. With this expression. And this one, sad. This one, angry. And this one, she is looking something disgusting. Okay, this thing. And this one, fear. Now let's go to the more. Now, this one, this lady talking to this guy, okay, he is crossing hand and making his head to the back. What is this posture?
Stay away.
Stay away, okay. Okay. This is called defensive posture. When someone you are talking to and he is sitting like that, he's taking the defensive. It looks like this lady telling him something, you are doing that, so okay, this is defensive posture. Okay, and what about this guy?
Judging.
Huh?
Judging.
Judging? Other? Who's more expert in communication skills? In body language? Okay. This is called arrogance. You have ego, looking at you like that and okay. So arrogance, he is seeing himself, knows everything and okay. This is annoyed posture. This is irritated. This is happy. This one. ها؟ صحيح وش بالله عليك؟ اي والله اي he's confused. He's confused. Yes, you're right. Yeah. This is so with time you know the body language. This is confused person. And if a lady or a man putting his hand and the other hand on his neck.
Taking a decision.
Huh?
Taking a decision.
A decision?
Take it.
He's taking a decision. Okay. This is worrying. When a lady is worrying, she's putting her hand like that. Okay? Okay. Now, more advanced. This lady looking to another lady with this. Terrian. Okay. This woman, in her thoughts, she's looking at her. Maybe she's jealous. Maybe she don't like her. Maybe she's compete with her. When she looks in this way, so be careful. Okay. And if someone looking directly to the left, only sharp, what it mean? Okay. She's remembering sound. She's remembering sound. And this one, right down, she's remembering feelings. And left up, she's remembering image. Okay. Now, you are in a meeting. You face this lady looking with this point. Who said bored? Excellent, yes, excellent. She's bored. She don't like, she want to go out. She don't want the meeting. And the other lady. I don't hear you. Listening. Questioning. Thinking. What else? Interested. Who said interested?
Memorizing.
Excellent. She's interested. She is concentrating in the meeting. Okay. And Sarhana. You met this lady and you offer for interview and you offer her, for example, 3,000 riyal per month, and her expectation was 6,000, and she put this hand and looked to you at this. This is close attitude. يعني خلاص no more discussion. But when you told her, but there is a bonus, incentives, and the extra, now she مش تقول كده من الصبح يعني. This welcoming attitudes. Now she opened her hand, she smiled, and start talking. When she closed her hand and look in a mask face, this is a closed attitude. No more discussion with this issue. Okay. This lady looking at you with this posture, with this body line. What is that?
Angry, yes.
Okay.
Accepting.
Huh? Go away. Yes, sure. This is annoying. She don't like you at all with this posture. And what about this posture? No, she's not angry. No, this is confident posture. She want to work, she want to do. Okay, now the last, there is another slide on here. What do you like, what do you think this posture is? يلا, who is the expert in body language? Fatah Rahman, you look expert. Yes. turning her head to the right and
She's distracted.
no, this is lying posture. When she is lying, she's doing like that. Okay? So this is lying body language. When she is lying, she will do like that. And this cross legs, it means not open for communication. You don't want to communicate. Okay, this guy looking to the right, doing this posture, and his legs is huh?
Correct information.
Correct information. Wallahi, you are expert, really. This guy is hiding something and he is menacing. يعني يتوعد. He want to fight, yes. Excellent. He want to fight with someone. He is waiting to do someone with else. So this posture, when you see it, and just run away. Now the last slide for the body language is you are in a meeting and you saw this guy. What do you think?
Anxious.
Restless.
Anxious.
What is this posture?
He's anxious.
He want to go. Good, excellent. When you saw him, it means he's not listening. He want to end the meeting and he want to leave. Okay. This posture actually it means I know everything. I don't respect the others. I am the best one. I'm so cute. This is not good posture. Nobody respecting this posture. So try to avoid it. Even if you are thinking that you are with your colleagues, try to avoid this posture. Okay. So now, when we saw all these photos, the three elements I talk about: the verbal, non-verbal, and the paraverbal. Sorry. The three elements. How much in this pie chart you give for the verbal, paraverbal, and non-verbal? 55%. For which part you will give? The non-verbal. Sure? Agree? Okay. And the 83% for what? Para. Excellent. So Dr. Albert Mehrabian from United States, one of the famous psychiatrists, published his famous study, the 7, 38, and 55. The 7 for the words you are saying, the 38 for the paraverbal, and the 55 for the body language. Okay. So now we come to the second part, how we listen to the patient. We should practice listening to the patient. Because listening to the patient, as I said, is a major part of the communication. It gives you a trust. The patient will trust you. If you are not listening to him, he is not going to trust you. And then improving the therapeutic success, because the patient compliance will be better. A better understanding of the patient problem. Without listening, you cannot understand the problem. And then make the patient feel comfortable. If you listen to him, he will feel that you are caring about his problem. Try to avoid discussion on the corridor. Don't listen to the patient on the corridor or in open places. And be careful not to interrupt the patient when he's expressing feelings. For example, he's telling you, yesterday I have severe pain at night, and then immediately told him, give me the investigation you did in that polyclinic. It means you are not respecting his pain, you are not appreciating. So whenever he is expressing his feelings, try to listen to him. And at the end of the discussion, try to ask the patient, do you want to add something at the end? Right. Now, who knows what is sympathy, what is empathy? The patient needs sympathy and empathy. Anyone knows?
If you put yourself in a position of the patient, that
Sorry?
is empathy. If you put yourself
Yes.
in the position of the person you're talking to,
Yes?
that is empathy.
Good, excellent.
And
So-
sympathy is just a
So,
fitting point.
excellent. Thank you, Dr. So sympathy, for example, patient having a bad news, so you tell him, I'm sorry about that. This is sympathy. But empathy, you put yourself in his feelings and try to express feelings. Try to imagine, for example, you have this disease and how you will suffer. And your face will be full of emotion to that person. This is called empathy. An example in our daily life, you are driving a car and you're coming to the main road and no one giving a chance to a guy coming from to cross the road. So he's waiting, and you are looking for him, and you say, I'm sorry for this guy. This is sympathy. But if you stop the car and let him pass and show him some feeling, this is empathy. Always the people like empathy, not sympathy. Sympathy, okay, everyone is sorry for the pain of the others. But empathy, you put yourself in this pain. So sympathy, I'm sorry for your pain. Empathy, I feel your pain. I can feel your pain. What is more than the empathy is the compassion. It means a doctor said, I want to end your pain. I will continue with you until your pain will disappear. So we need as much as we can to be compassionate, more than empathy with the patient. And everything we can, of course. Right, how we start the formal interview with the patient? First impression or first interaction is very important. So try, if the patient saw you, for example, with a mask face, busy, rushed, come, sit down, the first impression, he don't like you. But if you smile to him, welcome to him, start saying, please have a seat, and then you are busy with, for example, anything, the first impression will control the other interview you are doing. So try to start with a good start with everyone. Patient coming to see, and the charge nurse there, smile, welcome, wish him good health, like that. This start really prevent you many problems, because the father and mother will trust you because you welcome him. But if you stay in a mask face, he will say, they don't like me. They will not care about my son. The mother will tell the father, be careful of them. Maybe they will give them wrong medication. So the first impression is very important all the time. The major determining factor is not what the doctors say, but how the doctors say, how you say the words. As we said, the paraverbal and non-verbal. Not what you say, I am going to take care of your son, and you are not looking to the father. You are not showing any respect to them. You will not trust. So the first impression and how you say. Prepare to know the patient name before coming in, and also be the first one to grade the patient and establish a good eye contact. As I said, without eye contact, you are not respecting, you are not caring about the person you are talking to. And put the patient in ease. Try to have a seat and feel comfortable. This will give him more trust. Respect the patient confidentiality and maintain privacy. Now we'll practice how to break a bad news. This is one of the common scenarios we are facing. I put an example of a 6-year-old boy, Abdullah Ahmed. He is having a chemotic pallor, and investigation showing that he have acute lymphoblastic leukemia by bone marrow. So the father come near the pharmacy and show you accidentally, and he asks you about the result of the bone marrow. So what shall I do next is to invite the father in a single room and welcome him, maintain privacy. I will sit with him with a no barrier, establish eye contact, and no time pressure. I will take my pager, give it to my colleague. Please, I don't want any interruption. So the setting will be more comfortable for you and the father. If you wish to, for example, he told you that my brother is pharmacist, I want him to attend with me. Okay, you should welcome him. If he asks for anyone, if he's a friend, he wants to attend, it's no problem for us. And then assess the patient knowledge. Maybe the father is not, he's only primary school graduate, he cannot understand terms. So when you know the knowledge of the father, the communication will be much easier. Then, maybe a good start is to say, I'm doing now a scenario. How is Abdullah is doing today? Maybe he will tell me, Abdullah is not good. It's as you saw him the last time. Okay, and then I will start to give him the scenario piece by piece. It's not a rush. I will tell him he has leukemia. I will give it piece by piece. You know, Mr. Ahmed, Abdullah was having such a problem, and we did bone aspirate for him to see the result of this disease. Then I will stop for a few seconds. And then, Father, yes. And what was the result? I'm sorry, Mr. Ahmed, to tell you that Abdullah, the result was not good. And then stop. He will try to understand what is the next. He may guess what is the next. Tell me, doctor, what is the result? Don't spend more time, because he will be angry more. So you will tell him, I'm sorry, Mr. Ahmed, to tell you that Ahmed had a form of a blood cancer. Don't say blood cancer or cancer. When you hear cancer, it means death. But when you tell him a form of a blood cancer, this may help him asking you. He will ask you what form of a blood cancer. So a form of a blood cancer. Then immediately when he hears this bad news, he will turn his head. This is a normal reaction. Anyone told you a bad news, he will turn his head. You don't want to look at him, because this is the worst thing to hear. So he will turn his head. He may express feelings. So just wait for him. Say, I'm sorry again to tell you that. Give him support. He will express some sadness. Either he will deny, he will tell you, no, are you sure? I don't believe of that. Give me a report, I will go. Just if you said that, sure, Mr. Ahmed, I will give you a report. You can go whenever you want. I wish Abdullah to cure from this illness. We all here to support you. Or he will continue sadness, and you break the chain by, I can tell him, do you know, Mr. Ahmed, that this form of cancer has a 70% chance of a cure? Then he may start resuming talking to you. He will ask you, tell me more about that. And then you will start talking to him, explaining to him, what is this form of cancer? How is the management? He may ask you about chemotherapy, about everything. And then at the end you will tell him that I will do a report for you. You will go for an oncology center. He will handle you. Any help, offer help for him. Anything you can do. He may ask you, for example, to see his other son. He's sick now. He don't have appointment. Help him. Any help you can do, you should offer to the father of this patient. At the end, a warm handshaking with a wish for his son to be cured. If we did that, we will have a 10 years trust of this father, really. If we did this scenario in a good way, he will have the trust of the father for life. Now the second thing I want to talk to is how to be a good speaker. Every one of us could have this challenge. Every one of us مجبر أخاك لا بطل. He must do presentation in the department, in everywhere. And we never trained how to be a good speaker. Nobody trained us how to be a good speaker, how to speak to the audience. So everyone prepare a text and then try his best to present it. But there is some tools how to be a good speaker. Some elements you should take about it. The first thing, your posture. So what posture is comfortable to the audience? Is this posture is good? Do you like this posture, and why? مراقب امتحانات. طيب. مراقب امتحانات. What does this posture means? Weakness? Huh? Arrogance. This means he is trying to be, or he is humble. He is putting, this is called prisoner position. So he try to avoid. And he try to avoid crossing hands and looking at that I am the best professor in the world. The audience don't like it also. Try not to be shy. Just be relaxed. Leave your hands and speak freely with the audience. So your posture is very important. Okay, the second thing is the sound. Okay, your voice. Now, when you start, as I said always, the start is very important. When you start with this hall, for example, you will divide the hall into 4 quarters and distribute your vision and the voice. So how you say, good morning, and then look to that quarter, I'm Dr. Manaf, and then to this quarter, I'm going today to speak about, to that quarter, communication skills for medical staff. So all the hall now, I took their attraction. Eye contact, project my sounds. The sound, as I said, it must be not monotonic, polytonic. Enough for this hall. I will not shout to, I am talking today about, no. It's at the level of this hall. And when there is a small hall, of course, I will make the volume of my sound low, enough for the audience. I will not speak rapidly. I will not use fillers. Fillers, don't use fillers. For example, I am Dr. Manaf. I'm going to talk about communication skills. Don't put fillers, put space. Speak, space, and then complete your words. As I say, eye contact. Then, the speech content. For example, this is one of the slides of my presentation. Many of these speakers just write the iron intake from the diet, heme iron containing food, non-heme iron containing food. Heme iron is from the meat, poultry, and fish. The non-heme, what is that? You are reading the slides. We can read also. You should prepare the slide on your heart. 1, 2, 3, 4, 5, 6, 7, until you are ready. If you are not ready, don't make the presentation. Because the audience will not respecting you, really. You should know the slide by heart. You should have a look, okay. To remember, we cannot remember everything, but use. There are 2 forms of irons, heme iron and non-heme iron. The heme iron, maybe I want to remember, okay. Heme iron is the meat, poultry, and fish. The non-heme iron, I want to remember. The non-heme iron, just have a look, but not read. Non-heme iron is present in the green vegetables and others. The heme irons not affecting by its absorption not affecting by the tea. The non-heme iron, its absorption affecting by the tea and the other factors. So you can look to the slide, but not reading the slides. If you are reading the slide, don't make the presentation, because as I told you, the audience would not like your presentation. The third thing, make it interactive. Ask the audience.
How about if you are pointing at something?
Yes.
Whether using your hand or the pointer, is it something plus or minus?
Using the hand? Okay. You can use your hand. Make your hand free.
No, I mean, for example, you are talking, this is poultry and so.
No, use the pointer. It's good. Using the pointer is very good. I am saying don't read. Yani, for example, you know the slide well, and you said heme iron and non-heme iron. And then you go and show it. Heme iron containing like this system, and the non-heme iron present. And then you talk about what affecting the absorption. Its absorption improved by vitamin C. It's better to be mixed, for example, with orange juice. And its absorption decreased by phytate and the tannins which are present in the tea and others. So try to make it sharp. Don't make it. You should not read all the slide. Maybe you show the slide and give the important points also only, because this is more important to the audience. The audience will concentrate on it and understand it. And be interactive. How will you be interactive? Asking the audience, sharing with the audience, what do you think, Mr. Ibrahim? What do you think, Dr. Najib? And so on. Or some of them will volunteer to share the information with you. And at the end, be creative. Creative, it means do your slides, not copy it. Do your slide by yourself. For example, I will show you. All this is not present in any slide in the world. I analyze the text and make it in a graph. I take the text and analyze what is written in the paragraph to make it more attractive. I analyze it so the audience will like the slide. So this is called creative. How you make the slides, how you make your presentation, how you start it and then at the end make a conclusion. This is called creativity. So whenever you are creative, the audience will like your presentation, you will be a good speaker. Okay? So this is the end. I hope my presentation is interesting and thank you for your attention.